The staff of the Social Welfare Board are extremely committed in delivering quality care. I'm honored to lead such a giving organization that provides important health care to those unable to access traditional care.
My name is Russell Carpenter. I've been coming to this clinic since March of 2011. Megan was a nurse practitioner that did some blood work on me, and she noticed that my PSI was a little bit high, or PSA was a little bit high. She insisted that I go get an MRI, which I did, and it was clear. Then a CAT scan, it was clear. And then a bone scan, and it was clear. Still was persistent and said, no, I'm not buying it. It's still a little high. She somehow got me into Phoenix Urology with Dr. Partamian here in St. Joe. He did a biopsy on my prostate. Out of the 12 samples, 1 showed up cancerous. 3 weeks later, I had my prostate taken out. Went through some sicknesses, quadruple pneumonia and sepsis and on, life support 2 or 3 times. This place basically catered to me, gave me all my medications, opened doors that I could not open. I don't know how they managed to get Partamian to sign off on doing the surgery, but he charged me absolutely nothing.
On a normal basis, I would work 30, 40, 50 hours a week and pay my taxes, do what I'm supposed to do, but I can't afford health care. So a lot of people are getting that from here that they would not either have an option. So.
This clinic has given me benefits that I have immense gratitude for. They've helped me medically. They helped me acquire prescriptions where I had no funds to obtain them. I'm a type 2 diabetic and I need insulin. And when I first came to the clinic, I didn't have any money and I was out of insulin and I was getting sicker by the day. And the clinic stepped in and helped me obtain some insulin and some of my pills that I need to help my diabetes situation. And that was where I got started.
Been coming to the social welfare clinic for about 4 years. I was recently diagnosed with Arnold-Chiari malformation type 1. It's a rare brain disorder. It's been a long struggle. I've been to the pain center. I've been to probably 6, 7 doctors. No one really could figure it out what was wrong. Dr. Stuber here at the clinic, he stuck by me the whole time, and finally we figured it out that I needed an MRI because they've tested everything else and they figured out I had this rare brain condition. Like I say, he's the one that stuck with me the whole time and, made sure we got to this diagnosis.
He knew something was wrong and he listened to me, which was wonderful. And he wouldn't stop. He was relentless. He kept doing blood work and he kept sending me to different to the hospital for different medical tests, and he just would not give up.
And before all this, like I said, before we even got close to the diagnosis, I hate to say it, but there's a lot of times I just didn't want to be here. Just the struggle of all of it and everything. Yeah, I can imagine if this place wasn't here.
I just know that Megan, the nurse practitioner, and Dr. Stuber here at Patey Hall saved my life.
I said, Dr. Stuber, he's my hero. He'll always be.
I have always had a empathy for the poor. And what the public doesn't realize is that many, in fact, most of the patients that we see at the clinic actually work. And so the term welfare is probably the wrong word. It's a free clinic And I have a lot of respect for these people because they have to overcome many, many difficulties and roadblocks in their lives. And to work with them and help them is just very rewarding. St. Joseph is very fortunate. There's only about 2,000 free clinics in the United States. And most cities this size do not have a free clinic. And yet we have one that is very sophisticated. We see many, many patients, and we take care of very complicated illnesses. These are not routine colds and flus and stuff like that we see down here. We see patients that have multi-system disease and are very, very complicated cases, and we do a pretty darn good job taking care of them.
I want to extend my deepest appreciation for everyone who has helped sustain our mission over the course of the past 100 years. Our clinic is truly a community approach to providing health care to those with financial constraints. We provide medical care, dental, women's health services, and medication assistance. The Social Welfare Board is the medical home to 4,231 patients. Over the course of the past year, we've had over 27,000 patient visits. The clinic receives support in multiple ways. We receive significant financial support from the City of St. Joseph and Buchanan County. Local physicians, they give of their time. The hospital donates the cost of lab and imaging through their charity care program. And countless people, individuals, foundations, and grants give to us. For every dollar that we spend, the Social Welfare Board is able to leverage $6.92 in donated goods and services.
Places like this are needed. There are so many people that come in and out of these doors. Every time I'm here, I see new people. Sometimes I see the same people, but I see people getting better. I see people that just don't have a hope, or everybody closes their doors. These people open their doors with open arms.